what is ergonomics? So it's everything related to or designed for efficiency and comfort in the working environment. So what is our working environment? Is it a work desk? Is it an office? Is it at home most of the time? Or is it the dining table or the sofa? And this problem is actually worsened by home-based learning. So this week and next week is home-based learning. So our kids will be at home, and what do we do as parents? We'll give up our proper working station for them so that they have a better ergonomic environment, so they don't get backache or neck ache. The parents always sacrifice, right? So it compounds the problem. So we will have even a more unsuitable working environment. So many of us will be sitting in front of the coffee table trying to work using a laptop. It affects the health, definitely affects the health. And for the bosses here, it affects the productivity of your employee. So it's something to watch out for. Okay, so it will be a win-win situation if we can correct all this. So the sitting posture. So let's focus on the sitting posture, because I still believe we spend most of the time sitting when we work. So I divided into the back, the neck, the hip, the elbow and wrist, knees and the feet. So what I always tell the patients to do is, if you are using a new workstation, so make sure when you sit down, the first thing to check is the ears, the shoulder and the hip in a straight line. For my patients who have seen before, I keep repeating this for the ears, shoulders and hip in a straight line. Okay, that's the first thing you do. Don't care about the other things, okay? The next thing, adjust the armrest so that your shoulders is relaxed and the elbow is about 90 degrees, okay? So that's the second thing you do. Third step, then you adjust the chair. So the chair, if you look at the screen and my cursor, the chair should be high enough so that the armrest and the table is in line, allowing your arm, the wrist and the hands to slide in a straight line. That's the third thing you do. And then the fourth step is to adjust the height of the monitor. So you can see there's no point doing it the other way. There's no point adjusting the height of the monitor and then you adjust the other thing. Then you need to go back and adjust the height of the monitor, okay? So you follow the step, and the last step is the most simple, is make sure your feet is on the floor or resting on something. You can either put a footrest to rest your feet so that it doesn't increase the distraction pressure over the ankles and the knees, okay? And let's see. Okay, so let's focus on the back, the neck and the hip. So again, very simple. Straight line. Ears, shoulders and hip should be stacked in a straight line. So you can see the pictures on the left, the ears, the shoulders and the hip in a straight line, okay? Yeah, the pictures on the middle does show that it's a straight line, but there's excessive low back arch. So it's very tiring and the muscle is in spasm and so contract continuously. And when that happens, they reduce the blood supply to the muscle, and that's affect the muscle health and causes aches. And of course, this is too much arching forward, okay? A lot of stress over the spine, okay? So it should be a straight line. If need be, if there's no support, you can buy a portable support, lumbar support, and put it at the back. Again, the monitor should be at the eye level. Make sure that your neck is straight as well, okay? No matter what you do, we do not contour to the environment should contour to us, okay? And there are many tools available. So for laptop, I think it's essential to get a laptop stand and a extra keyboard so that you can actually do the necessary adjustment, okay? So it's not expensive. I just want to be comprehensive, so I went online. I tried to remove all the brands and stuff because I'm not going to endorse anything. I mean, it's $12.90 for a laptop stand, and it's so good. I think I'm going to get one for myself as well. Okay, so that's a laptop stand. Get a laptop stand and get a keyboard. Okay, again, I've removed the brand. It's $15, and the review is really good, 4.5 star, and it's sold like 113. So it's quite good. Okay, so I mean, what I'm trying to get at is that it can be done. It's not expensive. Okay, and should do it as soon as possible. So what happened if you don't sit well, you don't sit properly? What happened? No big deal, but that's what some people may feel, but actually it causes a lot of pain and stiffness, because the most common cause of pain and stiffness is due to poor posture, okay? So imagine we spend 8 hours sitting, okay? So when patients see me for back and neck pain, I can give them all sorts of treatment, but the take-home message that if you don't change your posture, the pain will recur no matter what, okay? So really important to change the posture. The causes can be due to muscle sprain. It causes relapse of the chronic back issues because of poor posture, okay? You may have a disc prolapse, you may have a spine arthritis, or you may have a spinal stenosis. Okay, so all these present as pain and stiffness. So the most common is neck and lower back pain. It's not common to have upper back pain because the upper back here is connected to the ribs. So imagine the rib cage actually holds the spine. So this level of spine, the upper back, is not very mobile. And when it's not mobile, it's not moving, it doesn't really wears off. Okay, so it's always relatively healthy. And I believe most of us seldom complain of upper back pain. And if you do complain of upper back pain, a lot of time their pain is actually from the neck, because at the back of the neck, there's a big piece of muscle called the trapezius that goes to the upper back. So a lot of time you may feel upper back pain, but the pain is from the neck. So sometimes if the pain has been there for too long, it's important to see a doctor and get it sorted out. So very simple, right? I mean, all the pain at the back, due to back pain, I will just take some medication, rest, correct my posture, and all is well, okay? But is it really true? Is it all back pain or back pain? But I mean, so there are some other side of pain that can refer to the back. In other words, it may not be from the back, it may be from other areas. So example, if you have a upper back, left or left-sided, you can be a cardiac ischemia, which is like a heart attack. So heart attack can present with pain at the back. If you have pelvic inflammatory disease or some of the OAG condition like fibroids, you can get lower back pain as well. And if you have gallstone, you can have pain at the back as well, on the right side, over the mid back here. So sometimes the back pain may not be from the back, but the classic features of a orthopedic, of a bone and joints back pain is that the pain is worsened when you move. Okay, so if you start to get rest pain, it means you're not moving, you're resting, and you still get a lot of pain. The pain is worsening. That's a non-mechanical, that's a resting kind of pain. Then you should be worried about other causes, not like having a heart attack. So these are important features we need to differentiate. So we don't expect all the patients to see a doctor when they have back pain, but when you have these signs, symptoms like persistent pain, tingling, numbness, weakness, when you cannot control the urine, when you cannot control the bowel, when you have unsteady gait, clumsiness, you should seek medical attention immediately.